Toxoplasma gondii is a eukaryotic parasite. It has a nucleus and organelles such as a mitochondria. It also has micronemes and rough trees that help it in attachment to other host cells. It is protozoan, meaning that it is a single-celled eukaryotic parasite. Toxoplasma gondii is also arc-shaped. Some examples of hosts for Toxoplasma gondii are cats and humans. Cats are considered to be definitive hosts, while humans and other warm-blooded animals are considered to be intermediate hosts. In the body, Toxoplasma gondii can form cysts in many types of tissues. They are common in brain tissue and in the central nervous system, but they can also be found in skeletal muscle tissue. In the body, Toxoplasma gondii can cause toxoplasmosis.
Disease symptoms. It causes toxoplasmosis by eating undercooked contaminated meat, mother to child transmission, exposure from infected cat feces, blood transfusion, or organ transplant. The symptoms that people who are infected may develop fever, headaches, swollen lymph nodes, body aches, and fatigue. And then the picture on the right, you can see the Toxoplasma gondii life cycle, and it starts with the parasite infecting a small animal. Then a cat ingests the animal, and the parasite invades the cells of the cat intestines. The parasite then develops into an infective form or oocyst. Then the cat releases the oocyst into the environment through feces. The parasite invades the body of another animal or human. Then finally, the T. gondii forms cyst and remains for life.
Hi guys, my name is Clemmy and I'm going to be telling you about the diagnosis and treatment of toxoplasmosis. If a doctor thinks that you could be infected with this, and you're pregnant, they will most likely do a blood test, to check for antibodies for that parasite. And if you do happen to have it, they'll probably test your baby too, using different methods, usually removing fluid from the amniotic sac, or maybe even an ultrasound, but the ultrasound isn't really good enough for diagnosing this, but it can show fluid buildup and other things that could indicate toxoplasmosis in your unborn child. In really severe cases, an MRI or brain biopsy can be used, but this is much less common, and is often not as necessary to use. For treatment, most people don't need treatment, in fact, but for those who do, Daraprim, which is a malaria drug, is often used. However, it can prevent your body from absorbing folic acid. So sometimes the doctor will give you a folic acid supplement. And in addition to this, in addition to Daraprim, your doctor will probably prescribe sulfadiazine as well, which is an antibiotic. In pregnant women, they can receive the antibiotic spiromycin because this reduces the risk of the baby getting hurt. And those are the ways to treat and diagnose toxoplasmosis.
A 25-year-old woman presented to a clinic at her 15th week of pregnancy with complaints of fever, headache, and enlarged lymph nodes. She was originally prescribed cefiximine and coamoxiclav, but she still remained symptomatic after her course of treatment. She was then seen at her ear, nose, and throat specialist, who ordered Toxoplasma serological testing to include IgM, IgG, and a biopsy of her lymph nodes. Both IgG and IgM were extremely positive, but the biopsy did not show Toxoplasma gondii parasites. The fetus was monitored at the 17th week of gestation but showed no issues. The woman was prescribed spiromycin, pyrimethamine, and sulfadiazine, but she could not tolerate the course of treatment and was ultimately stopped. At the 24th week of pregnancy, a fetal scan showed mild hydrocephaly and decreased amniotic fluid, which led to losing the child at 178 days post-conception. It was determined the woman was exposed by several cats living near her home in a rural farming area.